In order to take alginate impressions, it is necessary to first set up the appropriate armamentarium. You will need a patient napkin, paper towels, mouth rinse, impression trays, impression tray adhesive, 2 medium rubber flexible mixing bowls, 1 small rubber mixing bowl, spatula, utility wax strips, laminated wax bite wafer, alginate with manufacturer's measurer, and manufacturer's water measurer. As the clinician, you will also need safety glasses, mask, gloves, and an overgown. First, position the patient seated upright for visibility, accessibility, and to minimize gagging. Ask the patient to remove any appliances or dentures. Place a napkin over the patient's chest. Then, hand the patient paper towels. These will be used to catch saliva during the impression. Have the patient perform a pre-procedural rinse. Don a set of gloves. You will next examine the oral cavity for any factors that may influence the size or preparation of the impression tray or the procedure itself. Note any tori, exostoses, high vaulted palate. Also make note of buccally or lingually displaced teeth. Review any undercut areas as well. The patient is now ready for the alginate impression. When selecting the appropriate size tray for an alginate impression, it is important to assess the width and the length of the tray. For the width of the tray, the clinician must allow for adequate thickness, about 1/4 inch, of impression materials on both the facial and lingual areas. The tray must not impinge on the buccal gingiva and must not impinge on the lingual gingiva. The length of the tray must allow for the coverage of the retromolar pad and maxillary tuberosity. Anteriorly, there should be at least 1/4 inch clearance labially without impingement on lingual or palatal gingiva. When in doubt, use a larger rather than a smaller tray. In order to find a good fit, the clinician must try in the impression tray. For tissue retraction, with the index and middle fingers of the non-dominant hand, retract the patient's lip and cheek. At the same time, use the side of the tray to retract the other side of the patient's mouth to gain entry. With a rotary motion, insert the tray. Orient the tray and center it, bringing the tray to a position with 1/4 inch labial clearance. Gently lower the tray into place and examine the relationship of the posterior border to the most posterior tooth and retromolar pad or maxillary tuberosity, and the relationship to all other areas to determine if there will be adequate coverage. Use an index finger to feel the most distal area of the tray. This ensures all teeth are covered by the tray. If a patient is between sizes or modification of the tray is needed, application of utility wax is used to alter the shape of the tray. It can be added all around the tray or just on the back to lengthen the tray. strip of utility wax firmly around the periphery of each tray, allowing for the labial frenum. Place additional wax in the palatal area to support the impression material in this area. This is especially important for a patient with a high vaulted palate. For infection control purposes, remove one glove. Pick up the adhesive with the non-gloved hand. The clinician will then apply tray adhesive to the prepared trays. This is done by holding the tray over the wastebasket and spraying the inside of the impression tray. Use care to keep the spray contained within the wastebasket. When mixing the alginate impression material, it is important to follow the manufacturer's specifications for the type of impression material. In our clinic, we utilize regular set impression material. First, fluff the alginate powder can. For the maxillary impression, 3 scoops of powder is recommended. For the mandibular impression, 2 scoops are recommended. Make note that if you are using a large tray, add 1 scoop for each impression. For the purpose of this video, we are showing small trays and will use 3 scoops for the maxillary and 2 scoops for the mandible. To accurately measure the alginate powder, scoop a heaping amount of powder over the canister. Use the spatula to first tap the handle of the scoop to settle the powder. Then scrape the scoop level using the edge of the spatula. Pour the powder into a clean rubber bowl. Using the manufacturer's water cylinder, measure body temperature water and pour it into the second rubber bowl. Once everything is measured, don a new set of gloves. Next, sprinkle the measured alginate impression material into the water bowl. Quickly incorporate the powder and water using the alginate spatula. After a quick mix, lay the bowl on its side in your non-dominant hand. Using a stropping technique, press the material against the sides of the bowl. Using a figure 8 motion with the spatula, and rotate the bowl as needed until a homogeneous mixture is obtained. Do not exceed 1 minute in mixing. To fill the impression tray, you will work from one end to another, using care not to trap air bubbles. For the maxillary tray, load the back of the tray and push the material toward the front of the tray. Adapt the material to the tray thoroughly, but do not overload. Fill to the level just below the edge of the rim. Note that there should be impression material left over and kept in reserve. The extra material will be used during insertion. Dampen an index finger with cold water and pass lightly over the alginate material to smooth the surface. With an index finger, apply the reserved alginate material to the frenal attachment. Insert the tray following the same procedure used for your tray try-in, seating the posterior area first to force the material anteriorly in the tray. Maxillary impressions, you will stand at 10 to 12 o'clock for right-handed and 12 to 2 o'clock for left-handed. Seat the tray uniformly over the teeth. Have the patient lean slightly forward to avoid choking. Mold the cheeks around the buckle of the tray. Hold the tray with index fingers during setting with equal, firm, bilateral pressure. Avoid moving the tray. Allow the material to fully set according to the manufacturer's instructions. When the alginate has set, it is time to remove the impression. Hold the tray with your thumb and fingers of one hand. You will need to remove the impression with a sudden jerk or snap, but try not to put too much pressure on the handle of the tray, as it may cause it to break. Avoid rocking the impression, as such movements may cause permanent distortion. To break the seal or suction of the impression, place your finger under the rim of the tray on the buccal posterior side. Apply pressure until the seal breaks, using care to protect the patient's opposite dentition. Immediately, allow the patient to rinse. Assist with bits and pieces of excess impression material using the paper towel. Once the patient is cleaned up, rinse the impression under cool, running water to remove saliva and debris. Examine and evaluate the impression. Remove one glove. Pick up the Maxi spray with your non-gloved hand. Spray the impression with Maxi spray. Wrap the impression in a damp paper towel until you are ready to pour your model. To fill the impression tray, you will work from one end to the other, using care not to trap air bubbles. For the mandibular tray, load the tray in halves, one side at a time. It may be easiest to load from the buccal side of the tray, one half at a time. Adapt the material to the tray thoroughly, but do not overload. Fill to the level just below the edge of the rim. Note there should be some impression material left over and kept in reserve. The extra material will be used during insertion. Dampen an index finger with cold water and pass lightly over the alginate material to smooth the surface. With an index finger, apply the reserved alginate material to the frenal attachments. Insert the tray following the same procedure used for the tray try-in, seating the posterior first to force the material anteriorly in the tray. For mandibular impressions, stand at 8 o'clock for right-handed and 4 o'clock for left-handed clinicians. Seat the tray uniformly over the teeth. With the mandibular impression, instruct the patient to extrude their tongue briefly to mold the lingual borders. Have the patient lean slightly forward to avoid choking. Hold the tray during setting with equal, firm, bilateral pressure, avoiding any movement of the tray. Allow the material to set according to manufacturer's instructions. When the alginate is set, it is time to remove the impression. To break the seal or suction of the impression, place your finger under the rim of the tray on the buccal posterior side. Apply pressure until the seal breaks, using care to protect the patient's opposite dentition. Immediately, allow the patient to rinse. Assist with the bits and pieces of excess impression material using the paper towels. Once the patient is cleaned up, rinse the impression under cool, running water to remove saliva and debris. Examine and evaluate the impression. Remove one glove. Pick up the Maxi spray with your non-gloved hand. Spray the impression with Maxi spray. Wrap the impression in a damp paper towel until you are ready to pour your model. The wax bite is used to relate the maxillary and mandibular cast correctly. Warm the wax bite wafer until pliable in the smallest size rubber bowl and let the wax sit in the water while you are taking impressions. The patient is to be in an upright position. Adapt the wax to the maxillary dentition. Have the patient place her tongue on the roof of her mouth. Maintaining the tongue in that position, have the patient bite into the wax. Then, have the patient open, keeping the wax in place on the maxillary dentition. Remove the wax registration from the mouth. Rinse with cold water. Remove one glove and pick up the Maxi spray with the non-gloved hand. Spray the wax registration with the Maxi spray.